Before getting a blood test, many seniors make small but significant mistakes that can completely change their results, leading to unnecessary stress, confusion, or even misdiagnosis. These tests are often the key to detecting diseases early and managing chronic conditions, but accuracy depends on how well you prepare. If you're over 60 or caring for an elderly loved one, understanding what not to do before a blood test can make all the difference. Today, let's talk about the 10 most common mistakes seniors make before blood tests and how to avoid them for accurate, reliable results. The first mistake is eating or drinking before a fasting blood test. Many seniors forget that certain tests, like glucose, cholesterol, and triglycerides, require fasting for at least 8 to 12 hours. Even a small snack, tea, or coffee with milk can alter your readings. The body digests food and releases sugars and fats into the bloodstream, which can falsely elevate your test results. If your doctor says, fasting test, stick to plain water only, no tea, coffee, juice, or chewing gum. It might seem like a small detail, but it can completely change how your doctor interprets your health. The second mistake is taking medications or supplements right before the test without asking your doctor. Some vitamins, herbs, or prescription medicines can interfere with your blood chemistry. For instance, biotin, often taken for hair and nail growth, can distort thyroid and hormone test results. Blood pressure medication, cholesterol drugs, and even painkillers can impact your readings. Always ask your doctor whether you should take your regular medicines before the test. In most cases, your doctor will guide you on which ones to skip or take later that day. The third mistake is dehydration. Many seniors forget to drink enough water before their test, thinking fasting means no water. That's not true. Being dehydrated makes your blood thicker and harder to draw, which can cause dizziness, fainting, or inaccurate results. Drinking enough water keeps your veins plump and makes the blood draw easier and safer. Aim to drink 2 to 3 glasses of plain water in the morning before heading to the lab. The fourth mistake is drinking alcohol the day before the test. Alcohol affects liver enzymes, blood sugar, and lipid levels. Even one glass of wine or a small drink can elevate certain test results or mask potential issues. For seniors, the liver processes alcohol more slowly, which means it stays in your system longer. Avoid alcohol at least 24 to 48 hours before your blood test to ensure clean and accurate readings. The fifth mistake is ignoring timing instructions. Some tests must be done at specific times of the day. For example, cortisol levels peak in the morning, and iron levels are more stable after waking up. If you take the test too late, results may appear abnormal when they're actually fine. Seniors who rely on others for transportation sometimes delay their appointments, not realizing that timing affects accuracy. Always check the time window given by your doctor and try to book morning slots whenever possible. The sixth mistake is intense physical activity before the test. Exercise can temporarily change your hormone levels, liver enzymes, and blood sugar. A brisk walk or climbing stairs before your test can cause misleading results. Seniors often think light activity doesn't matter, but even mild exertion can impact your numbers. Try to stay relaxed and calm before your test. Rest for at least 15 minutes before the blood draw to stabilize your body. The seventh mistake is wearing tight clothing that makes it hard to draw blood. Tight sleeves can restrict blood flow, making the process uncomfortable or causing bruising afterward. Seniors with delicate veins should wear loose, short-sleeved shirts or clothes with sleeves that can roll up easily. This simple choice can make the experience smoother and quicker. The eighth mistake is skipping breakfast after a fasting test and not planning to eat soon afterward. Seniors are more prone to dizziness or low blood sugar after giving blood, especially if they have diabetes or blood pressure issues. Bring a healthy snack like fruit, nuts, or a sandwich for after the test. Eating soon after can help you recover faster and avoid feeling faint or tired. The ninth mistake is not informing the lab technician about health conditions or anxiety. Seniors sometimes stay quiet about feeling nervous, dizzy, or having conditions like diabetes or blood disorders. This silence can lead to complications during or after the test. Always tell the technician if you've had trouble giving blood before, if you bruise easily, or if you tend to faint. They can take precautions, use smaller needles, or let you lie down to make you more comfortable. The 10th and final mistake is not following up on results or misunderstanding them. Many seniors get their tests done but never discuss them in detail with their doctor. They might assume that no news is good news, or they misinterpret the numbers on their report. Blood test results can be complex, and what's normal for one person might not be for another. Always schedule a follow-up appointment, whether online or in person, to go over your results with your doctor. Ask what each reading means, what's improving, and what needs attention. Your blood tests tell a story about your health, don't skip the ending. Getting a blood test might seem routine, but for seniors, it's an important window into how your body is functioning. Each small choice you make before the test, whether it's skipping breakfast, taking medication, or exercising, can influence the outcome. The goal isn't just to get numbers on a page but to understand what those numbers say about your body and your future health. Preparing properly shows respect for your own health and helps your doctor make the best decisions for your care. Think of it this way: accuracy begins before the needle even touches your arm. A little preparation can save you from unnecessary worry, extra visits, or false alarms. So before your next blood test, take a few minutes to plan ahead. Drink water, skip the coffee, check your medications, and get a good night's sleep. Avoid alcohol, stay calm, and communicate with your healthcare team. Your health deserves attention to detail, and these small steps will ensure your test reflects your real condition, not just what you ate or did that morning. Remember, prevention and awareness are the strongest medicines we have. By avoiding these 10 common mistakes, you take control of your health journey, one blood test at a time.